DHT is commonly associated with puberty changes and baldness in men. However, DHT has various health benefits and is possibly effective at improving certain diseases. Dihydrotestosterone, or DHT, is a sex hormone created from testosterone in the body. It plays a major role in the development of masculine characteristics, being body hair, muscle growth, and a deep voice. DHT is critical to the development of the penis and the prostate in men. It's a much more powerful hormone than testosterone, and it plays a major role in male pattern baldness. Men with an enzyme 5AR deficiency are unable to make DHT from testosterone, and they have reduced development and function of reproductive organs. DHT activates androgen receptors that are needed for sexual differentiation during fetal development and changes in males during puberty. It's also necessary for maintaining a sex drive in men. DHT is a sex hormone created from testosterone, but more powerful. It maintains sex drive and develops masculine characteristics. DHT may help those with diabetes and high blood sugar by regulating glucose metabolism. According to a study in mice, it may lower blood sugar levels and help with type 2 diabetes in men. Applications of DHEA to rats increased the levels of DHT, and it improved insulin sensitivity, weight, and body fat. Men between the ages of 34 and 70 showed improvements in memory when they were treated with DHT skin patches. DHT can improve sexual ability in men, regardless of factors like age and obesity. Along with testosterone, it's necessary to maintain a healthy sex drive in men. DHT helped boys who were born with reduced penile function. It's the main hormone to prevent erectile dysfunction in rats. Women with lifelong sexual abstinence were more likely to have low levels of free DHT in their blood. DHT is crucial for sexual health, libido, and for erections in men. Higher levels of DHT were associated with lower amounts of fat deposits in the heart of healthy men with coronary artery disease. Lower levels of DHT and testosterone resulted in an increased risk of cardiovascular complications for men who were undergoing testosterone-lowering treatment for prostate cancer. Elderly men with higher levels of DHT have lower death rates from heart disease. In women, muscle DHT levels correlate with strength and power. DHT appeared to increase muscle mass in postmenopausal rats. Men are 3 to 20 times less likely to get multiple sclerosis, lupus, rheumatoid arthritis, Hashimoto's, Graves' syndrome, Sjogren's syndrome, and other autoimmune diseases. This may be due in part to male hormones having a protective effect against autoimmune conditions. In animal models, DHT was useful in treating autoimmune conditions such as multiple sclerosis, prostatitis, Graves' disease, and uveitis by balancing the immune system. Specifically, it can lower T helper cells, and these are higher in autoimmune diseases. The androgens, or the male sex hormones, can have many different effects on the immune system, such as enhancing immune response or diminishing immune response, enhancing antibody-mediated responses to exogenous antigens and decreasing antibody production, enhancing T-cell cytotoxicity and decreasing T-cell proliferation, and many other effects. Declining levels of DHT and other sex hormones in older men are associated with declining cognitive function. Testosterone's anti-anxiety benefits were shown to be a result of the action of DHT in the brain. The drug finasteride, which lowers DHT levels in the blood, may induce symptoms of depression. DHT is vital for bone density. Increased blood levels are associated with higher bone density in men. DHT relieved pain that was caused by diabetes in rats. A study found that a group of men with male pattern baldness had higher levels of DHT. Higher levels of DHT were found in blood samples obtained from men with premature baldness. DHT may trigger inflammatory acne. DHT is critical for the normal development of the prostate. but it can also contribute to benign prostate enlargement. DHT can fuel prostate cancer cells if testosterone production is stopped by removing the testicles. On the other hand, men with lower levels of DHT are more likely to get prostate cancer, have an advanced form of prostate cancer, and have a decreased survival rate from prostate cancer. DHT helps the prostate develop, but too much of it can contribute to benign prostate enlargement. In one study, women who were treated for major depression had higher levels of DHT and other male sex hormones. Steroid, which inhibits DHT production, is effective in treating women who are suffering from male-like hair growth. Some ways to increase DHT are exercise, losing body fat, and sprinting. Increasing consumption of dietary fats and zinc. Supplementing with creatine, DHEA, caffeine, tribulus, and tongat Ali. Some ways to decrease DHT. There's the 5-AR inhibitors, like finasteride. These prevent testosterone from converting into DHT, or in older men, supplementation with testosterone. Supplements like red ginseng, curcumin, and saw palmetto. And having foods such as black tea, flaxseed, fenugreek, soy and green tea, reishi mushroom, copper, nettle root, polyunsaturated fatty acids, especially gamma-linoleic acid, vitamin B2, pumpkin seed oil, and amla. Some products that inhibit the effects of DHT. Chyawanprash contains certain tannins and omega-6 fatty acids which are anti-inflammatory and protect hair. Chyawanprash is an Indian jam made from many different herbs and spices. Taking berberine with meals. The herb futi. Black pepper, which contains piperine, has been shown to inhibit androgens like testosterone and dihydrotestosterone. DHT is a powerful sex hormone created from testosterone. It helps develop reproductive organs and masculine characteristics in men. It also boosts libido and sexual health. Besides that, some researchers believe that DHT may support blood sugar control, mental health and cognition, bone and muscle mass strength, and even immunity. You can increase it by exercising, losing fat, and consuming healthier dietary fats and zinc. Too much DHT may contribute to male pattern baldness, depression, and hair growth in women, and prostate enlargement in men. According to some studies, some natural strategies may be able to lower the DHT, including tea, soybean, nettle root, and pumpkin seed oil, red ginseng, curcumin, and saw palmetto. In order to assess your DHT levels, a blood test is your best option.